Hello, Dr. Dalton. Today I will be teaching you all about cerebral palsy for my CSD 3202 alternative final exam. So, what is cerebral palsy? Cerebral palsy, or CP, is a neuromotor disorder, which means that it's a disorder that has damage to the central nervous system that can affect fine motor skills, gross motor skills, movement, balance, and posture. The etiology or causes of cerebral palsy can include fetal stroke, random gene mutations, maternal infections, traumatic brain injuries, asphyxia during labor, and other infections that can cause brain inflammation. One of the most common causes of CP is actually unknown. So what are some characteristics or signs and symptoms of CP? So one of the biggest symptoms is spasticity, which means that the muscles are stiff and have exaggerated reflexes. There's also rigidity, which means that the muscles are stiff but with normal reflexes. There's ataxia, which is poor muscle coordination. There's athetosis, which is slow writhing movements. Some of the other symptoms and characteristics include involuntary movements, tremors, muscle tone variation, which means that muscles are either too stiff or too floppy. Some other indicators of CP show up in delays of reaching the normal milestones of motor skills, including pushing up on the arms, sitting up by yourself, and crawling. Other symptoms are favoring one side of the body, difficulty walking, sucking, eating, speaking, swallowing, and moving precisely, and difficulties or issues with excessive drooling. So who is affected by cerebral palsy? So only kids, infants, babies can be diagnosed with cerebral palsy. That's because the onset of CP occurs before, during, or after birth. So adults cannot be diagnosed with cerebral palsy. It's something that has to be from birth or shortly after birth. According to the CDC, 1 to nearly 4 per 1,000 live births or per 1,000 children have cerebral palsy. It is the most common motor disorder in childhood. There's a higher prevalence of CP for children who are born premature or underweight. CP is a non-progressive disorder, which means that it does not get worse as the child gets older. However, there is no cure for CP, but treatment such as speech therapy, occupational therapy, and physical therapy can help significantly. When does CP occur? So damage or abnormal development of the brain occurs before, during, or shortly after birth. There are two types of way to have CP, which the first one is congenital CP, which means that the child was born with the condition. And this can, as stated above, it can occur before or during birth, as long as they are born with the condition. Causes of congenital CP include damage to white matter of the brain, abnormal brain development, bleeding in the brain, and lack of oxygen to the brain. The other type is acquired CP, which symptoms of CP begin 28 days or more after birth. So this is shortly after birth, but still very close in that time frame. Causes of acquired CP include brain damage, infections, issues with blood flow to the brain, such as stroke, blood clots, abnormal blood vessels, heart defects, or sickle cell disease, and head injuries. So what are the types of CP? There are 4 types of CP, which includes spastic, dyskinetic, ataxic, and mixed. So the first one, which is spastic, cerebral palsy, is the most common type of CP, with about 70 to 80% of people with CP having spastic cerebral palsy. So this is indicated by increased muscle tone, resulting in stiff muscles and movements. And as we can see here and here, The damage is to the motor cortex or the cerebral cortex, which which is what makes the muscles appear stiff and tight. So the next type of CP is dyskinetic, which only affects 6% of the population. And that is characterized by uncontrollable muscle movements that could be slow or rapid, difficulties moving hands, arms, feet, and legs, difficulties moving the face or tongue, and which can produce problems with sucking, swallowing, and talking. The muscle tone can vary from being too tight to too loose. And as we can see in this picture, the damage is to the basal ganglia here as well. And then the next type is ataxic cerebral palsy, which affects 6% of the population. And it is characterized by shaky movements and problems with balance and coordination and positioning in space. And this arises from damage to the cerebellum. And the last is mixed. And mixed CP has symptoms of more than one type of CP. So it can be multiple, it could be two, it could be whatever combination. However, the most common combination is spastic dyskinetic cerebral palsy. And if we look here, we can see that the damage of mixed is to multiple areas of the brain. So now, how does CP affect body movement? So as we can see in the picture, cerebral palsy affects different parts of the body. So the first one just affects the legs, which is the most common in premature babies. Another type is where it only affects one side of the body, which is the type that my friend has. And then there's another type that affects the entire body, which is most common with babies who experience a lack of oxygen. So how does CP present itself as an SSD? CP is a neuromotor disorder, which means that it is classified as an organically based speech sound disorder. It can cause childhood apraxia of speech, which produces significant speech acquisition problems. Some of these difficulties include difficulties with speaking, motor skills, excessive drooling, trouble swallowing, and delays in speech development. Some of the phonetic errors include fronting, stopping, gliding, backing, the vowelization of L and R, nasalization, and lateralization of fricatives. Some of these other errors are from coordination difficulties that can lead to weak syllable deletion, stopping of fricatives, final consonant deletion, voicing, devoicing, and consonant cluster reduction. So where does intervention for CP occur? Intervention for CP includes physical therapy, occupational therapy, recreational therapy, and speech and language therapy. Therefore, intervention can occur wherever the child is receiving these services. Some places where these services occur would be in hospitals, schools, and other places that provide physical, occupational, recreational, and speech therapy. So why did I choose cerebral palsy? So as I stated earlier, my friend has cerebral palsy. She has it where it only affects one side of her body, her left lower leg in particular, which makes it difficult for her to walk. She's able to walk still with no pain or whatever, but she is her CP makes her leg drag when she walks, which is due to the stiff muscles. And so I was really interested to learn more about CP because she's one of my really good friends, and I wanted to know more about her and more about, her experience, and after hearing about this in class, I was just really excited to be able to educate myself more on cerebral palsy. So yeah, that's why I chose it. In conclusion, cerebral palsy is a neuromotor disorder that occurs before, during, or shortly after birth. Only children can be diagnosed with CP. It can be congenital or acquired, but only acquired shortly after birth. The types of CP include spastic, dyskinetic, ataxic, and mixed. As a speech sound disorder, CP can cause difficulties with swallowing, sucking, eating, speaking, and precise motions. When speaking, children with CP can produce weak syllable deletion, stopping of fricatives, final consonant deletion, voicing, devoicing, and consonant cluster reduction. Thank you so much for your time, and I hope you have a wonderful summer. And here are my resources. Thank you again. Bye.